I'm just going to say a few things to follow on the excellent presentation from Itamar. We are working together on a study that Itamar was mentioned in the first in the sort of first part of his presentation, and we received this fabulous news about the grant from Alzheimer's Research UK for our research proposal to study the feasibility of using ultra-low field MRI in obtaining structural diagnostic markers in dementia. So in other words, we would like to see if we can use this relatively new technology. I mean, it's new in the sense that there is now, with the improved software and hardware, the possibility of using these very, very low field machines in clinical indications, and one of them potentially could include dementia diagnosis. So this is a study that we will be running with Itamar, but also with our Dorina, the organizer of this wonderful conference, and other co-applicants also include Professor Tabet, Professor Shergill from Kent, and Joe Roda, who's a clinical academic from Kent, and advisors and other collaborators. So I would like to now move on to tell you a little bit more about the background of ultra-low field imaging. I think this audience knows very well that brain imaging plays a crucial role in the assessment for possible dementia disorders. And we also know from our practice, especially for those of us who work in clinical services, that access to brain imaging can be limited across the country. There is a competing demand from other medical specialties for scans, and dementia diagnosis is hardly ever considered a priority. So our patients tend to wait quite a long time sometimes for imaging. There's a bit of a bottleneck in the diagnostic pathway. Then the waiting for the scan reports can also add to that waiting time. There is also a trend across the country in some dementia services where diagnosis is made actually without access to any brain imaging, or brain imaging is really sort of almost rationed to patients who meet very specific, strict criteria. The other complication may be that some patients actually find it quite hard to get to an MRI scanner or a CT scanner. They may live in remote areas and or have mobility transport difficulties that just limit that access. So the answer to all these complications could be potentially rolling out of an ultra-low field MRI, which is sustainable, cheap, mobile, and relatively simple to operate, with quite an automated operation scanner that will be a valuable alternative to that expensive, static, and quite complex classic MRI that's used at the moment. The advantages in the image acquisition and the hardware has led to the improved quality of the images acquired with ultra-low field technology. I think it's fair to say that the image quality and the signal-to-noise ratio is still lower for ultra-low field scanners, but with the advances in the hardware and the software and image analysis, it has been already possible to use these techniques in the diagnosis of conditions such as stroke or multiple sclerosis, brain tumors, and other conditions. And you can see on this slide an illustration and comparison of high field MRI at the bottom row and a low field MRI at the top in acute ischemic stroke and intracerebral hemorrhage. Up to date, the clinical usefulness of ultra-low field MRI in dementia has not been investigated, and that is where our project comes in. So we would like to use a portable MRI scanner, ultra low field MRI scanner, and you can see an example of one here. This is a swoop system produced by a company called Hyperfine. And you can see that it is a relatively small, compact, and portable or wheelable machine that can be quite quickly deployed to different localities and setups, such as, for example, a GP surgery or a memory clinic. It can be used in an emergency room or an ICU without the risks of transporting the patient, you know, through the hospital corridors. You know, potentially even could be used in a patient's residence. There is also an increased availability of access to populations, to people, for example, who might have contraindication to have a classic MRI scan, for example, those who have implantable medical devices. So what we would like to do in our studies, we would like to include 70 participants who will be recruited from memory clinics across Sussex and also Kent, who will agree to have a routine MRI scan at our Clinical Imaging Sciences Centre, CISC, and also have the participate in the study with, so basically have images acquired with the ultra low field machine. And what we would like to do is to compare the quality of clinically relevant information that can be obtained from both scans. So we will look at kind of qualitative assessment, which is like, you know, usually performed by the neuroradiologist who reads the report visually, but we would also like to develop quantitative tools, image analysis software that can help with objective quantitative interpretation of scan results. We would also want to explore patients' experience and satisfaction with having both types of scan and see whether there is any advantage for patients' comfort, and for the sort of acceptability of this form of scan to the population in memory clinic. In terms of the impact of the study, well, certainly this is likely to generate new knowledge about showing ultra low field MRI and its ability in identifying structural markers such as regional, global volume loss, cerebrovascular disease, and potentially other brain pathologies, and also establish the best combination of sequences and scanning time to make sure that we get the clinically valuable information with the least discomfort to our patients. And this is likely to improve the diagnostic pathway by making access to brain imaging more timely and more accessible for everybody. And potentially this is also likely to work as a sort of springboard to further research of ultra low field MRI utility beyond the diagnosis. So thinking about adjusting disease progression, monitoring disease progression, or perhaps prognosis for the future. So that's the fabulous study I wanted to talk to you about, and thank you very much for your attention. I know this is very late in the day already, but if you have any questions about this study or anything that Itamar could answer, please do let us know. My email address is at the bottom of the slide. Thank you.